Assalamualaikum and good morning, everybody. See you again. Today, our topic is about anti-emetic drugs. Our learning objective for this topic is about pathophysiology of vomiting, how to classify the anti-emetic drugs, and describe the mechanism of action, clinical use of anti-emetic drugs, and the adverse effect of it. What is the definition of nausea? It is an unpleasant feeling to vomit. Nausea generally precedes vomiting, but it can occur by itself. Right? In comparison, emesis of vomiting is referred to sudden forceful expulsions of gastric content through the mouth, sometimes through the nose. The mechanism of emesis can be divided into three components. The efferent inputs, right? The efferent inputs, okay, and then the CNS, the vomiting center, and then the efferents, okay, inference. All right. Okay, we talk about the efferent first. The first one is the CTZ. Okay, chemo trigger zone. All right. The stimulus may be a drugs or uremia. Then from peripheral receptors in the GIT, mechanoreceptors in the intestine wall are activated by abnormal contractions, distension, or physical damage. Okay. Potentially harmful chemical stimuli can also activate chemoreceptors located at the intestinal wall. Right. Then we talk about vestibular apparatus. Any motion or vestibular toxicity can cause vomiting, right? And then on the cortical structures, efferent impulse may also arise from the unpleasant sights and odors, right? Okay. The CNS, all the impulse from this efferents goes to the central nervous system. This integrative vomiting center is located in the medulla, right? It coordinates the efferent impulse to produce a complex patterns response resulting in the vomiting reflex processing and actions. All right. Okay. So then the efferent pathway. The neuro pathway involved in the motor acts or vomiting are associated mainly with the phrenic nerve to the deferens, the spinal nerve to the abdomen and intercostal muscle, afferent vesical autonomic fibers to the gut, and the visceral afferent fibers to parts of the voluntary muscles of the phrenic and larynx. Both the autonomic and somatic system mediates to the vomiting reflex. Okay, this diagram shows the key event of the vomiting reflex. Okay, the fundus of the stomach become flaccid, diaphragms contract sharply, stomach muscle and abdominal muscle contract sharply, hypersalivation occurs, epiglottis close, and then the cardiac sphincter relax. So this is the key event of vomiting reflex. As you can see from this table, there are 6 neurotransmitters involved in the emesis process. Okay, there is a dopamine, serotonin, acetylcholine, histamine, and the substance P. Okay, there is also receptors involved with the neurotransmitter. Okay. Now we go on drug for vomiting. We can classify antiemetic drugs into 8 groups: serotonin antagonist, neurokinin receptor antagonist, centrally acting dopamine antagonist, antihistamine, anticholinergics, corticosteroids, benzodiazepines, and cannabinoids. Serotonin antagonist. Example of this drug is ondansetron. So we have other drugs also, but most popular part is ondansetron. Okay, they usually act by selectively block 5-HT3 receptors in the peripheral as well as in the brain. Okay, commonly we give ondansetron for emesis linked with the chemotherapy. Okay, post-operative procedures and post-radiation nausea and vomiting. Okay, so basically we give to patients who receive remote chemotherapy, post-operative and post-radiations. Right. Ondansetron may cause headache and constipations, but the profound adverse effect is the prolongation of QT intervals, and this will affect the heart of the patient. Now we go on the neurokinin or NK1 receptor antagonist. Example of this drug is apripitans. Okay, it acts selectively at the NK1 receptors. Okay, it blocks this receptor. It can cross blood-brain barrier and occupy NK1's receptor in the brain. Okay, therefore this drug can prevent both central and peripheral stimulation of vomiting. Okay. In a patient who needs chemotherapy, the main side effects are profuse nausea or vomiting. In this type of patient, we usually give a few drugs to prevent nausea and vomiting. Apripitans is one of the medication in this combined therapy to prevent nausea or vomiting in chemotherapy patients. Okay, apripitans, we have a drug interaction with warfarins. All right. Now we look into the centrally acting dopamine antagonists. Okay, phenothiazides such as prochlorperazines is a drug generally prescribed for an antipsychotic patients, right? But this drug has potent antiemetic and sedative effects. It acts by blocking dopamine receptors in CTZs and also at the muscarinic receptors. This drug is effective against low or moderately emetogenic chemotherapy agents. The adverse effects, such as extrapyramidal symptoms, limit the usage of these drugs as antiemetic. All right. Another drug that acts centrally on dopamine is substitute benzamides. Right. One of the examples of this drug is metoclopramide. It is effective at high dose against hematogenic chemotherapy, preventing emesis in around 30 to 40% of patients and reducing emesis in most of the patients. Metoclopramide works by inhibitions of dopamines in the CTZs. It also enhances gastric motility and therefore beneficial for the patient with gastroparesis. The side effects also includes extrapyramidal symptoms. Other drugs can be used as antiemetics, corticosteroids, antihistamine, anticholinergic, benzodiazepines, and cannabinoids. All right. Sometimes we use antihistamine for prevention of motion sickness. Okay. In case of vertigo, we also use antihistamines. So anticholinergic also used to prevent motion sickness. All right. Okay. Cannabinoids is also a drugs. Cannabis can be used to prevent nausea and vomiting in chemotherapy patients. All right. So that's all about antiemetic agents. Okay. Thank you for listening to this video.